Hey y'all, I'm back. This video is gonna be why nursing. A lot of people ask me that, or just why nursing, why are you so passionate about that, and why is that something that you really want to do? And I got my little notes right here so I can make sure I'm looking and seeing what I'm gonna say. One of the biggest things that made me want to do nursing is my great-grandparents. I was fortunate enough to live with my great-grandparents up until I was 13, 14, 2008. So, yeah. My great-grandfather and my great-grandmother both was put on hospice, which is palliative care, which is basically they had a terminal illness and wanted to stay at home and no more medications. So just comforting them and pain medications. It's not really, you're not really trying to cure the disease anymore. It's basically just comfort care in the well-being of their own home. So a hospice nurse will come every weekly and talk to us and the family. And I was helping in care of my grandmother and my great-grandfather, my great-grandmother and great-grandfather. My great-grandfather passed first. He had pancreatic cancer. So I helped in care with him. I bathed him, I fed him, made sure he was comfortable. And even before that, he had diabetes. So he would go to the diabetic clinics and all that. And I used to go with him. And that was just something I was like, hey, I can really do this. And I really just like to care for him and for people in general. So nursing was really something that is near and dear to my heart for that reason. And also, as nurses, we see the beginning and end of life. So it's just awesome to see a baby come out into the world, and then it's sad, but you see the end of life as well, and you're with somebody holding their hand on their last breath. So I think it's a career that it's rewarding, and honestly, it's a privilege to be able to care for someone in their most vulnerable state. I also love nursing because we have a lot of options. Like, I don't even think I knew how many options there was before I got to nursing school. I was like, okay, yeah, like you could do this, you could do that. That's cool, work in a hospital. And then I had seen that hospice nurse when my grandparents were sick, my great-grandparents were sick. Then once I got to nursing school, it was like all these different options. Like people was home health nurse, hospice. I even looked up one time, it was like diabetic management, like literally teaching patients about their disease process and going into their home, talking to them about a way that they can help their disease process and manage it. So that was like amazing to me. It was over 150 jobs that I can have with my bachelor's in nursing. So that was like awesome to me. Like, what other job has this many options? Like, and then it's awesome because it's like you don't ever want to burn yourself out to where you're not giving your whole 100% to your patients. So I feel like it's good with nursing because then when that happens to you, when you feel like, hey, I don't know if this is for me anymore, or I don't really like this or this area, you can just change just like that. It's like, what? Is this like too good to be true? So I really like nursing because of that reason as well. So that was a little bit on why I chose nursing. It's near and dear to my heart. As I always say, I think it's just awesome to be able to have a career where you're touching lives day in and day out. It's almost amazing. Well, it is amazing to see the beginning and the end of life. And then to my great-grandparents, who I love so much and I miss so much, they really helped me get into this career. And my great-grandfather would be calling me Nurse Cleo right now. So yeah, it's just something that I really cared about, and I know I can do. I can really do and love my job. So I want to know what you guys' reasons are for nursing. So comment, subscribe, like below, and tell me y'all reason for nursing and why it's y'all thing.